Hey everyone, good to see you all again. This is Josh, for those of you who are new to my channel, and I'm a current first year medical student at the TCU Burnett School of Medicine. Right now, we actually just finished our 2-week anatomy boot camp, and this anatomy boot camp dealt with the musculoskeletal anatomy. So, what we did during this boot camp was that we actually got to dissect cadavers, which is something I was really excited about doing when first entering medical school. And it's usually the thing most people tend to think about when they think of medical school. It's one of the first things on their mind. And I was really happy to dissect the cadaver. And I remember the first day that we dissected it, we had like a session with an ER doctor as well as the school's psychiatrist about our feelings of, cutting open a person who used to be living about 3 months ago. And in my group, I remember I was the first person to make the cut. I was really wanting to make the cut and just to see how it felt, the blade going into the skin, and to get a feel for that, and just to see how it was like to to make a cut in a person for the first time ever. And to be honest, when I was making the cut, I didn't think too much about it, but reflecting upon it, it's I'm extremely grateful that that these people have donated their bodies to science, because it really does help us learn. And it helped me tremendously a lot with anatomy this time, because it's not only about seeing the differences between a textbook or an app like Complete Anatomy, as well as other ways in which the muscles and bones are drawn, but it's also about feeling it too. When you're able to like palpate the muscles as well as nerves versus arteries. Nerves tend to feel a lot smoother. And in arteries, you could feel that they're tubular, because when you compress them, you could feel the ends press against each other. And so you could tell it's tubular in that sense. So I was really not that squeamish at all when it came to cutting the cadaver and dissecting it and learning all of the muscles. And honestly, I think out of all the units I've had so far in medical school, anatomy is actually my favorite one. And I think a part of it has to do with the fact that I really feel like on this test, I did very well. Because in other tests in medical school, I felt like there were a couple of tricky questions. And I knew in anatomy that there were some questions that were trying to throw us off, but it didn't really faze me at all. So I felt the best about this test compared to the rest of them. And it's been my favorite unit because it's the most hands-on. Literally what we were doing in class, because for anatomy, class is only 3 hours the entire day. 2 of those 3 hours were spent dissecting the cadaver and cleaning it up and trying to get a better picture of the muscles. So I thought that was very cool, And then actually it turns out that we used the dissected cadavers on our exam. So we had, they put pins in the muscles, and we had to ID which ones they were specifically. And yes, we did have to learn all of the muscles of the forearm as well as the leg. Because in anatomy, I know in English, colloquially, we call the thigh and the leg. But in anatomy, technically the bottom part of the leg from the knee down, that is called the leg. And then the knee up to the hip is called the thigh. So those muscles were challenging to learn, but once you get them, you get them. And that's what I really like about anatomy. It was just strict memorization. And I felt like I did fairly well with that. I used Anki, and then one of my classmates was actually very nice to upload her former undergraduate anatomy textbook. And so when she did that, I actually downloaded that textbook onto GoodNotes on my iPad. And it turns out that this textbook had really good pictures of all of the muscles. So what I did was, using GoodNote and my iPad pencil, my Apple Pencil, I would literally quiz myself, and I would write on I would draw arrows and point out which muscle I thought was which. And what was beautiful is that textbook had the answer like right below it. So I literally quizzed myself like dozens of times over and over until I finally got the location of the muscle correctly. And then I would also use my desk, which I could show perhaps maybe in a separate video because I don't want to mess up my frame right now. But I'll show you guys in another video my desk, and I've been using that to write out a bunch of the actions of the muscles, because that was something we were tested on too, like what the muscles did. Like a good example is that the deltoid, it would cause abduction of the arm, which is raising it up like this. So it would do that. That's the action of the deltoid. So anyway, that's a specific example right there. But I felt pretty good about anatomy, and in terms of studying, I definitely felt less stressed about it. I still was studying fairly hard, and to be honest, I felt like my sleep schedule was a little weird, and that was kind of my fault, I genuinely need to get better about time management in that sense. But other than that, I really loved this week. It was awesome, and we're gonna have more anatomy boot camps later on. I know for a fact with our curriculum, we're going to have a GI anatomy boot camp, as well as a boot camp related to other systems. But the next unit we're gonna have after anatomy is musculoskeletal and derm, which I'm really excited for because you guys may know, I mentioned that dermatology is one of the specialties I'm very interested in, and I'm doing a research project in dermatology right now related to pemphigus vulgaris. The other specialty I'm interested in is plastic surgery, and that's actually another thing I want to update you guys on too. Today I actually went back to the same cosmetic plastic surgeon, and I shadowed him again. And this time I saw an abdominoplasty, another one, as well as a breast implant, which is pretty cool, and that was something I hadn't seen before, as well as a hair transplant. And those procedures were really awesome. And this cosmetic plastic surgeon, he's really awesome. His name is Dr. Plano, by the way, at least on Instagram. He was so awesome. He bought me a boba, actually, right after his last surgery, because today's Friday. I did my anatomy exam from 8 a.m. to 9 a.m. and I was literally free the rest of the day. So I texted this plastic surgeon, and then I told him, hey, turns out I'm gonna be free after 9. Can I come in and see one of your surgeries? And he said, of course, yeah, please, by all means, come over. And so I drove over from Fort Worth to Plano to go see him again. And it was really awesome. I love his personality. He's amazing. I know some people, with surgeons, some of them can be rude, but this guy, he's awesome. He's completely nice, and it just really depends because people have different personalities, even surgeons as well. He sutures really fast, I'll tell you that. And actually, that's why I have this suture kit out, because after seeing that procedure, I was like kind of inspired to, finally to open up my suture kit, which I'll do right now, But I don't know if you guys could really see it, but this suture gift was actually gifted to me during white coat ceremony of medical school. So I have this suture kit here, and this suture kit, it actually comes with a couple of pieces of cut skin. Well, it's fake skin. I'm not too sure the material that they use for it. It's like some sort of gel. But I'll show you guys, I'll take out one of these skins, so to say. It's not real skin, but it's like a gel. So it has if you can see it, it has all of these like different cuts in it, and then you have to like do different types of procedures to suture them together. So I'm really gonna start attacking this and the suture kit and working on these cuts as well. How to stitch them back together. So I'm gonna put this guy away, and while I do that, I'm actually gonna open up what's in here too, because it turns out on the first day of anatomy, they were teaching us how to use a scalpel, and they had a bunch of these like synthetic skins out as well. So, and I asked the clinical team lab, hey, are you guys gonna do anything with these? And they said no. You could take a few of them if you want, and that's exactly what I did. I took quite a few of these. So what I'm gonna do with these guys is I'm gonna cut them right here, and then I'm gonna practice suturing them. Because along with the suture kit, they also gave me a lot of this what they call polypropylene monofilament, which I assume is a string that you would attach to the suture needle that you would use to suture up a wound and close it up. And then in here we have the equipment. So you guys can see that. Right here we have like a scalpel, and then they also gave me like a couple of blades here. And then here we have some scissors. And I think below this is a hemostat. So I think they gave me 2 hemostats, and they're both the same size. And actually and then forceps as well. So scalpel, if you guys can even see it. I don't know if the camera is like if it's zoomed 2 in or 2 out, but that's the scalpel blade, forceps. And then I have a hemostat in my hand, and here's the other hemostat, and then those are the scissors. And then the blades are up here. So actually something that my cosmetic plastic surgeon mentor was telling me was that a good thing to do right now, whenever you have spare time every now and then, is to actually start practicing closing the hemostat. Because if you guys can see it, it has like these little notches in here, and the hemostat, it's what's used to hold the suture needle. I don't know if you guys heard that clicking noise, but he told me to practice on both my right and left hand and practice clicking it over and over again. Yeah, you guys see, you might have heard it right now. Yep, it's supposed to make that noise whenever you clip something. And we were actually using hemostats as well as forceps while doing the cadaver dissection. Although to be honest, for a cadaver dissection, a hemostat wouldn't be too useful because they're more used to hold suture needles. Yeah. He told me to practice both on my right and my left hand. And for those of you guys who are watching, who are like residents or surgeons, please let me know if I'm holding this wrong. I'm actually going to watch a video, and I really need to educate myself on how to properly use these surgical tools. And that's a big reason why I'm interested in plastic surgery, is because you get to do this. You get to suture quite a lot. Yep. So that's why I'm in this like state where I'm really in between plastics and derm, because I really love the science behind derm and the fact that you can figure out treatments in terms of like pharmacologic drugs, but with plastics you do get to suture, which is something I really want to explore more of. So I'm closing up this little kit, at least where they contain all of the metal equipment, and I'm gonna put it back in here. So I'm really gonna use this, because right now we have Thanksgiving break, and right now it's my last day in Texas until I go back to Thanksgiving break, because today's Friday and my flight leaves tomorrow back to Hotel California. So because of airport security, I'm not going to risk taking this, because I don't want it to get confiscated or anything like that, because there is a scalpel, and it's not a good thing to really carry knives. So I'm just going to leave this behind and work on it after I come back from Thanksgiving break. But yeah, I'm really excited to start cutting these apart, suturing them together, messing up, because that's really all that it's about, and just getting a feel if suturing and doing surgery, in that sense, is something that I'm a fan of, because that's something I'm really like having a huge debate about in medical school, whether I like surgery or if I like being an internist better. I'm not too sure, honestly. I've narrowed down my interests pretty much down to 2 specialties, but they have some overlap in that plastics and derm, they do deal with the skin, even though plastics also deals with fat and muscle and soft tissue. But they're very different in the sense that derm deals with it's very clinical, whereas plastics is very surgical. So I'm not entirely sure which one I like better. I could see myself doing both for now. So it's a really hard debate because you can't really go wrong with either specialty. They're both fantastic specialties, and that's kind of the frustrating part of figuring this out, you know. But yeah, I'm gonna go home tomorrow, and I'm excited for that. And just before this, I was actually hanging out with two of my classmates and very close friends who are also interested in competitive specialties too. And I find that it's really nice that we're like banding together and we're becoming pretty close friends in that regard. And I've been feeling that in medical school more, you know, as we get to know I get to know my classmates better, and I just like this sense of collaboration, you know, and it's been really awesome in that sense, you know, that we're all in the same boat, and there's like 60 of us in our class, so it's actually a very small class for a medical school. So we're all in this together, you know, and with TCU being such a new school, it's really super beneficial for students who are really interested in competitive specialties, because my very close friend, the two close friends who I actually just got gelato with, one of them's interested in neurosurgery, and then the other's interested in plastics primarily. And those are very competitive specialties. And then likewise, I'm interested in dermoplastics, which are also extremely competitive. So we kind of just like group together, and we're like, hey guys, you know, if there's a research project you need help on, like keep us in the loop. And that's something we're doing, you know, as our research projects are starting to mature a bit more. Because right now with my derm pemphigus project, we're really starting to get into the details of it. Because the last time I met with my derm mentor, we pretty much had a journal club where I had to read 10 papers related to pemphigus vulgaris, the mechanisms and the variants of the specific disease, because it's a fairly rare disease and there's a lot of variants to it. And I also had to read on another disease called oh gosh, these names, they're gonna be the end of me. Hold up, let me pull out my papers just to not misquote, in case there's any dermatologists who are watching this video. You never know who this video gets recommended to. Oh yeah, hidradenitis suppurativa. So actually, I had to read about that disease, not because I'm really studying it, because hidradenitis is a very common dermatological disorder. It's a chronic inflammatory skin lesion. But the reason why my derm mentor, he had me read about hidradenitis is because there's the racial differences in treating it have actually been studied a lot more compared to pemphigus vulgaris. And something that I was shocked to learn about was that the main treatment for pemphigus vulgaris, which is rituximab, and for those of you guys who are curious about the mechanism of how rituximab works, is it's a monoclonal antibody that attacks the CD20 receptors on your B cells, which will essentially inactivate your B cells and suppress your immune system. So it'll prevent B cells from producing antibodies. And in the case of pemphigus vulgaris, it's going to prevent your B cells from producing IgG antibodies. Now, there's it's an extremely rare variant that in which the B cells will produce IgA antibodies. But actually, my mentor told me he's only ever seen one patient with that variant. And I remember when I was meeting with him, essentially our last meeting was like a journal club discussing these 10 papers. He was, I could tell he was like extremely excited when it came to talking about the fact that all of these different variants of pemphigus, and that's something that I've learned doing research, is that you should definitely do your homework, because your mentors will be really happy when you do so. And you know, I'm definitely gonna keep this dermatologist, keep working with them too, because if it turns out I actually really am like committed to derm, like if I go all into derm, you know, I'll need a letter of recommendation from him, and it'll be very strong, starting off working with someone from your first year, and they get to know you fairly well, and they can write you a very, very good letter. So yeah, that's my project with pemphigus vulgaris. So I had to read about hirudentitis because there were the disparities in treatment for hirudentitis were studied much more compared to pemphigus. And actually, as far as we know, the disparities in care for pemphigus have not really been studied that much. And the treatment that I was talking about, rituximab, the point that I was going to make earlier was that the treatment for pemphigus, at least rituximab, the biggest treatment that I read up on, it was only approved by the FDA in 2018, which is not that long ago. So it's kind of crazy that this treatment, it wasn't approved that long ago. So you can imagine that studying disparities in the care of pemphigus is something that has not really been explored at all, given first off how rare this disease is, because if I'm quoting correctly from my reading, there's it affects 1 to 5 people out of every 100,000 people in the population. So it's quite rare, actually. Yeah. But yeah, I'm excited about this project. And what's awesome is that the next unit we're going to study is musculoskeletal and derm. And I looked ahead and I saw that one of the days is strictly going to deal with pemphigus vulgaris and bullous pemphigoid, which is another autoimmune blistering disease. So I feel pretty good about that day. And I'm gonna definitely use this Thanksgiving break to read up on like other dermatological conditions we're gonna learn in school. Kind of stinks we only get 2 days of derm though, I wish we got 2 weeks, but I'm happy with what we get. Yeah, and then with the musculoskeletal part, I hear that there's a lot to cover, so I'm definitely gonna study up on that too. But I'm also gonna take Thanksgiving break to decompress a little as well, because anatomy and endocrine, they were quite a lot. So I feel like I just need to, reconnect with my family, with my friends back in California. And I'm gonna go visit Universal Studios again too, if my past doesn't have any blackout dates on those days, because I just need to spend some time, relaxing a little during this Thanksgiving break. And that's why I wanted to make this video right now. I might make one in California, we'll see. I can't make any promises or guarantees about that, because I've been uploading less frequently. I've still been consistent at uploading once a month, but given how crazy busy medical school is, I told you guys that medical school is the busiest time in my life. I genuinely say that, and I'm not kidding about that. That's why it's hard, because you've never been so busy until right now. And, finding the energy to make YouTube videos is a bit difficult. Like right now, it's 12 a.m. My parents would not be too happy. I know they watch my videos. They're probably not too happy I'm staying up this late just to record a video. But sometimes you just have to push through it to do so, Like I should be sleeping right now, and I will be soon, But that just gives you like a perspective as to what goes into recording a YouTube video, in medical school. You sometimes have to find very interesting hours to do so. Because today and Friday, what I did was I woke up at 6 a.m., to study a little more for my final exam for anatomy, at the end of this block. Then from 8 a.m. to 9 a.m., I took the anatomy exam. I was able to ID the muscles, the bones on the cadavers. And then at 9 a.m. up until 3 p.m., I drove from Fort Worth to Plano to go see Shadow, my cosmetic plastic surgeon. And then I came back. And then from 3 to 5 p.m., I took a nap, 4:30 p.m. And then actually at 5 p.m. I met my 2 close friends, to get gelato. And I ended up staying with one of them to get pizza afterwards. And I came back and I packed everything to fly tomorrow back to California, and I just set this up, to show you guys my YouTube video. So it's been a fairly busy day, but fairly fulfilling though. And I'm gonna try just to keep taking it one day at a time, because I think something that I was mentioning with my friends earlier was that it's very easy to get overwhelmed in medical school by looking into the future too much, because a lot of us, with me and my other plastics friend who we were both talking about how, and I would need to look up the specific statistics, in order to confirm this, but we were talking about how I think there was only like 207 spots in residency as of last year. That's how many residents they took into plastic surgery, which is really not that much, nationwide, considering all of the medical schools. And that was something that worried us a little bit. And something that we were both talking about was that, those statistics, they can be scary, and we're not going to try to focus on them, and let them freak us out, because that wouldn't do any good to our mental well-being in medical school. And that's something a lot of my friends who are interested in pursuing competitive specialties have been dealing with. We know it's competitive, and we know not everyone is gonna match into these specialties, and I think there's just a certain fear factor of us, not matching into it, and that just leads to more stress, So it's during times like these we need to really have each other's backs, and that's why I appreciate like going out with the two of them, because it just kind of reassured me and reaffirmed me that we're all in this together and we have everybody's backs, and we're at this new school that doesn't have too many departments in competitive specialties, and we're all through it together. We're not alone in this, and there's several of us who are also interested in neurosurgery and orthopedic surgery, dermatology, plastics, ENT, and there's quite a few students who are also interested in family med, emergency med, pediatrics, so yeah, we're all in this together, and that's something I've really come to appreciate, especially today, hanging out with my friends after the anatomy exam, and then after shadowing the cosmetic plastic surgeon. And he was giving me good advice too. He told me that this plastic surgeon, he told me to take this break to decompress, because I need to take time to relax, and I need to come back to MSK and derm very strong. And given my reading with my research project, I feel pretty good about the some portion of the derm week, and I'm definitely going to read more of the pre-work that we've been assigned for dermatology. It's actually something that really intrigues me, so I'm like really excited to learn about it. And the muscles are pretty cool too, something that of course I say dermatology is exciting, but I don't mean to say that I'm not excluding other organs like the muscles, the nerves, or the bones or the brain. I also find that interesting too. Trying to keep an open mind here. I don't want to pigeonhole myself into those two specialties and like say, oh, the rest of the human body is not interesting, because it all intertwines together. All right, but yeah, I think that's pretty much it for this update. After doing anatomy and dissecting cadaver for the first time, I gotta think about what I'm gonna do for my thumbnail for this video. But that's a future me problem. In the meantime, I'll see you guys later, and thank you for staying for this update.